When the MTF presented our transition plan to a COVID resilient nation, we explained that let's be prepared to see infection numbers rise and also ICU cases and deaths going up. So the rapid rise in infections over the past 18 days is therefore not unexpected, except it is happening sooner than what we had anticipated. We had hoped for a more controlled preparatory phase, and that's why we came up with that phase, where we can get more people vaccinated, adjust our healthcare protocols, try out several pilot projects to open up social economic activities, travel, while keeping infection numbers at a manageable level, maybe 100, 200. And then we will enter the transition phases where we open up further and expect cases to start rising along a steeper curve. But by then, we would be well prepared to manage it. Unfortunately, Delta variant never followed our plans, which is also not surprising. So this rapid and exponential rise in daily infections that we are experiencing now is what every country that seeks to live with COVID-19 has to go through at some point. But we always wanted to go through it differently from other countries in two major ways. The first is that we want as few deaths as possible. Practically every country that has gone through this kind of transmission wave has suffered hospital collapses and high death tolls. We want to avoid that. If we can achieve that objective, then we will also achieve our second objective, to go through this experience in a different way, which is to avoid a long, hard lockdown, a repeat circuit breaker. And that is, in fact, what New South Wales in Australia and Vietnam are going through now. So the key to go through this experience differently from other countries, as few deaths as possible without a prolonged hard lockdown, the key is vaccination. As DMS explained, vaccines are very effective in protecting us against severe illnesses, ICU cases, and deaths. So are we achieving the two objectives we set for ourselves currently? We take stock. Our cases started rising sharply 18 days ago on the 23rd of August when we hit almost 100 cases, 94 to be exact. And from then, 24th August onwards, it's been rising at a very steep curve, along a very steep curve. Through the 18 days, ICU numbers were kept at 5 to 7 so far. There were 2 new ICU admissions and 1 death due to recent cluster over that 18 days. The MTF will be distributing a chart to illustrate this. So we are seeing high number of infection cases, but so far for 18 days, ICU numbers, admissions, and death has been kept low. But we should expect it to rise. Therefore, there is strong evidence to show that vaccination has weakened the relationship between number of infections and number of patients with severe illnesses and deaths. But it is early days yet, and there is always a time lag between infections and the onset of severe illnesses. As far as possible, we don't want to reverse course in our transition plan. We need to monitor the incidences of severe illnesses and deaths closely in the coming 2, 3, 4 weeks, as Kenneth has mentioned. So let us navigate this wave first before we embark on further steps to reopen. So for now, we are not reversing. We still want to progress on our transition journey, but we are not racing ahead. We are actively responding, watching, and monitoring. If I just repeat this in a few Chinese words, is 冷静观察，稳住阵脚， 沉着应对. The imperative now is to quickly adjust our healthcare protocols. And that is a very, very urgent task because we are no longer dealing with 50, 100 cases a day, but multiple times of that. The old ways do not work anymore. So what number of infections are we potentially dealing with? Based on the experiences of other countries, mainly in Europe, which are also highly vaccinated, a transmission wave, we know, does not last forever. It typically takes, if you're lucky, 4 weeks, if not 8 weeks. So 30, 40 days, we can assume that, to peak before it comes down and then stabilize. So during that rise of 4 to 8 weeks, daily cases can double every 10 days. And I think we've been seeing that, which means be prepared for 4 to 5 doubling cycles. So we are 18 days into the wave, as I mentioned earlier, starting 23rd of August, and it has doubled twice, and it's on its way to the third doubling cycle, which is why we saw 100 on 23rd of August, and 3rd September, it became 200, and then it crosses 400, and now it is in the process of doubling from 400 to 800. And beyond that, if we think about in terms of 5 doubling cycles, there's 2 more to go, meaning daily cases may double, then from 800 to 1,006, and then 1,006 to 3,002, hitting a peak before starting to come down and stabilize. So what I have just said is what is possible, having observed what happens in other countries. How it actually unfolds will, of course, depend on what we do collectively, whether we will test extensively with the help of employers, reduce our interactions where possible, wear our mask properly and diligently, get ourselves tested when required, isolate ourselves when we are ill or when we are tested positive through ART. And if we can do that, maybe we can avoid 5 doubling cycles. Maybe we can get away with 3, 4 before we settle down. Let me just cite what are the numbers in other countries having settled down and then living life quite normally. I just came back from Europe from a G20 meeting. I can see many European countries are living life quite normally. So if you look at South Korea, life is quite normal there. If we look at the infection rate, and here let's measure it by number of infections per 100,000 population per day. So it's a rate comparable across different geographies. South Korea is about 3 to 4 and living life quite normally. Italy, Denmark, Sweden, 9 to 10. 9 to 10 infections per 100,000 population per day. Germany is about 11. Netherlands about 15. France is about 18. Switzerland is at 30. USA is at 45. UK is 55 or so. We are currently 7. So at the lower end of all these countries that have been living with COVID, but rising, and it may surpass many, peak before it comes down. But that is how other countries have dealt with it, going through a wave in order to live with COVID.